Hello, we're back with some examples of a no-touch femoral nerve block. Want to review just a few things before we look at some examples. Number one, remember the transducer position has to be parallel to the inguinal ligament, which can be found by connecting a line between the anterior superior iliac spine and the pubic tubercle. If we place the transducer on the medial third of this, we get an image that looks something like this, where the femoral vein is most medial, lateral to that the femoral artery, lateral and deep to the femoral artery is the femoral nerve, and the lateral structures, namely the fascia iliaca and the fascia lata, as we move from lateral to medial, we see these two fascial layers split. The fascia iliaca passes over the iliopsoas muscle, over the femoral nerve, and deep to the femoral vessels. So this is an important relationship and landmark to visualize. We can use this relationship to our example by advancing either out of plane or in plane, and as we advance the needle, giving small doses of local anesthetic which appear hypoechoic on the screen. As we pass through the fascia iliaca, we will see local anesthetic spread in a tissue plane that is superficial to the iliopsoas, superficial to the femoral nerve, but deep to the femoral vessels. This is the most characteristic distribution pattern we see. We can also see a pattern that runs deep to the fascia iliaca, but between the femoral nerve and the iliopsoas. Just like the last view, however, the local anesthetic does pass deep to the femoral vessels, and either of these patterns will result in a successful block. Here's an example of an actual block. We see the femoral artery and femoral nerve. Our needle point is represented by the white arrow. And as we inject local anesthetic, you see a very distinct tissue plane develop deep to the fascia iliaca. So we're spreading superficial to the iliopsoas muscle, superficial to the femoral nerve, but deep to the femoral artery that we see pulsating. Here's another example. We see the femoral artery and femoral nerve. Our needle insertion point indents the fascia, as you see there. It's a good bit lateral to the nerve. Again, though, we're going to see the characteristic fascial plane. As we fill up this space with local anesthetic, it will pass over the iliopsoas, over the nerve, and deep to the femoral artery. One more example showing the indentation of the fascia, femoral artery, femoral nerve. And as we pass through the fascia iliaca, we see the characteristic display of local anesthetic passing over the iliopsoas, over the nerve, and if we watch patiently, we see that that tissue plane eventually also goes deep to the femoral artery, as shown here. Notice in all three of these examples, the femoral nerve stayed adherent to the superficial surface of the iliopsoas muscle. And this is fine. You do not need to get a donut sign. If you get a donut sign, that's fine also, but you certainly don't need to move the needle or advance the needle towards the nerve to dissect it off the surface of the iliopsoas muscle. One more example here. And sometimes just when you think it's not going to go deep to the artery, it does. So that's another successful block. Here's a dissection we were telling you about where the local, instead of going superficial to the nerve, actually goes between the iliopsoas muscle and the nerve. So here's an example of that coming up right now. There it is. That technique works as well. So here's the tissue plane we were talking about. This is not the fascia iliaca. This probably represents the investing fascia of the iliopsoas muscle. One more example of a dissection deep to the femoral nerve. You see our needle advancing lateral there by tissue movement. A little dose of local hypoechoic on the screen. We slowly advance our needle. So this tissue plane is probably between the investing fascia of the iliopsoas muscle and the iliopsoas muscle, you're going to see the local go deep to the femoral nerve and deep to the femoral artery here as well. So there it goes. Once again, this technique is also successful. There you see the tissue plane passing deep to the nerve and deep to the femoral artery. Thank you. We'll see you on our next lecture.